You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic, the podcast that takes the skin talk beyond the clinic doors. I'm Dr. Emma Craythorne, consultant dermatologist and host of the After Hours Skin Clinic. And this episode, we're going to be talking about everything that you might need to think and prepare for if you're going to see a dermatologist. I'm joined by the lovely Dr. Ellie Rashid. But before we get into this episode, if you like what we're doing here at the After Hours Skin Clinic, then please give us a follow, share us with your friends and family, or give us a shout out on social media. It really helps people find us. We also love receiving your questions, and actually this episode was inspired by a question, so do keep them coming. Anyway, enough of that and on with the episode. Hi, Ellie.
Hello, darling.
So, shall we have a think about somebody who's going to a dermatology consultation for the very first time? What should be going through their mind? What should they be thinking about before they go into it? Because if you go into an NHS consultation, you're only getting 10 minutes, so you want to get the most out of it. And if you're going to a private consultation, usually it's around about 30 minutes. So it's actually not that long if you have a particularly complex problem or you just kind of want to get your money's worth. So how should somebody approach that?
The first thing I would advise people to do is to think about their skin condition. So just to take a moment to think, how long have I been suffering from this skin condition? How does it look like? How does it make me feel? What symptoms does it give me? And then to typically write this down, because it's really hard to remember everything when you're in the middle of a dermatology consultation. So you want to be able to refer to some notes so that you can check when it started, what makes it better, what makes it worse, what the triggers might be for it, how it makes you feel, what the symptoms are. Does it get better at particular times of the day or worse? Does it get better or worse in particular seasons? And then I guess the most important thing is if you have an evolving rash, something that sort of is coming, going, and doesn't always look the same or can look different at different time points, take some photographs.
So you can keep a list of all of these things in the notes section of your phone. And then if you have been taking photographs, bundle all of those photographs together so they are in the one folder so that when you're in the consultation, you don't have to scramble through pictures of your holiday and your niece. And
I love that.
Yeah, I know you do. All right, I know everything about you now.
Normally over their shoulder. Oh, that looks interesting. It looks like a nice place.
So put them all in that one folder to really disappoint Ellie so you can go straight to the photos. And then keep exactly that record of what has been happening and especially how it's made you feel. But as well as that, having everything in one place about your own medical health. So what has happened to you over the years? Because sometimes you might forget that something's happened to you and that actual thing might be relevant. So as well as the skin rash or skin lesion or lump or bump or whatever it happens to be, your own medical history in really good detail, the medicines that you have been taking in the past or that you're taking right now, write the name of those medicines down, write the dose of the medicine that you're taking, and any skin treatments that you're putting on your skin, take a photo of them so that we can see what they are. Because often I'll have someone come and say, yeah, I've been using this cream. Okay, what cream? Oh, I don't know the name of it.
The white one. That's what I get. Which cream? The white one.
It's the one in the white tube with the grey. And then you're going, is that Dermavate or is that Betnavate?
And then you start like trying to guess. So you're Googling like Dermavate. Does it look like this one?
Yeah.
Does it look like this one?
So take a picture of everything that you've been using on your skin and write down any of the drugs, or just take a picture of the drugs and medicines that you've been taking. And in the world of supplementation that we really do live in now, if you are taking supplements or things like probiotics, get a photo of them so we know exactly what they are.
Yeah. The other thing to say is if you started a cream or stopped a tablet, when did you start and stop it? And also, why did you stop it? So was there a side effect? Was it that it wasn't working? Like, think about the impact that that treatment had on your skin condition.
And then also what is really important is have a think about your immediate family and a little bit of your extended family as well. Is there anybody in that sphere? Have they had skin problems in the past? Have they got skin problems right now? And could possibly that be what's affecting your skin or similar to your skin? So have a good think about all of those avenues as well.
Next thing is not to get your nails done just before the appointment. So dermatologists will look after hair, nails and skin. And we get quite a few clues from looking at people's nails. So if you have nail varnish on or if you've got gel nails on, then we can't make that assessment accurately. So ideally not have any nail varnish or nails on.
When you come to see the dermatologist, you have all of that information that you have planned. And then when you come, if it's something that is on your face, then, your makeup is going to be taken off. So even if you come in with a lot of makeup, it will have to be removed. So if you're somebody who really loves wearing makeup and feels more comfortable in makeup, you can bring your makeup with you so you can apply that after the clinic appointment. But if you want to really get in the good books of the dermatologist and actually save yourself some time, because, taking off your makeup takes time and that reduces the amount of time that you're going to be examined, for example, then come in with a very clean face that doesn't have any makeup on it.
And the other thing to say is come in with the cleanser that you would prefer to use, because we would just use a standard cleanser that we all have in clinic, but that might not suit your skin. So just bring one that you're comfortable to have used on your skin to remove your makeup so we can assess your skin accurately.
The next thing is that you have to be prepared. So whenever you're coming in to see the dermatologist, they will be looking at all of your skin. And in a very good skin exam, that does mean all of your skin. So if you've got a single mole that needs to be looked at, a dermatologist will examine every part of your skin. Usually you'll be offered a chaperone if you feel more comfortable with that, but do be prepared that that is likely to happen.
And please don't worry about your legs. We really don't care, or look at whether your legs are shaved or not. And we really don't care about the appearance. We just want to examine your skin, get you the best treatment to get things as good as possible, as quickly as possible.
I think that is actually really important, because lots of people will come in and say, oh, I'm sorry about this. I haven't shaved my legs. Or I'm sorry about this. My toenails are in a mess. You can know that generally it's always better than mine.
Yes, I know.
So you've prepared, you've come in, you've had the lesion examined or the skin rash examined, and then you've had the rest of the skin examined as well. It's really important that you take some notes. So bring in your pen and paper so that you can write down notes as you go along if you find that helpful. Most dermatologists will provide you with a letter afterwards so they can detail everything that's happened. But sometimes not everything that you thought was important might be on that letter. So it's really worthwhile making notes from the clinic as well as you go along.
One of the really important things is to write down what your skincare routine is at the moment. So write down in the morning, what are you washing your face with, what moisturizer you're using, what sunscreen you're using, and then the evening, what you're doing as well, so that we've got a really clear idea of whether you're using any irritant ingredients or how we can optimize your topical skincare as best we can.
And I think just so that you get the maximum amount of time, if there's any forms to be completed, make sure you allow time to either complete them there before the appointment or do them online before you arrive, eking out every second of that appointment.
I had a patient that did a whole PowerPoint presentation. I've never had a PowerPoint presentation before, but she came in with her iPad and then was like, do you mind if I just go through my history showing this PowerPoint presentation? It was the best thing I'd ever seen. It was so detailed. It's so beautifully done. Showed the whole evolution of her rash. Beautiful.
Is that the one you then use to present at a meeting?
And I now have used that as a template and I send it to all my patients so they can do exactly the same.
Love it.
And we'll definitely be asking lifestyle factors. So in terms of smoking history, how long you've smoked for, alcohol history, the type of job that you do, and hobbies that you might have. And then particularly if someone might be presenting with a rash that we think might be secondary to a reaction to something coming into contact with the skin, then it's important to think about the hobbies or the chemicals or ingredients that you might be coming into contact with that might be a little unusual. For example, paints, glues, plants, that sort of thing.
And have a list of questions. I mean, I know that some of my patients may say whenever they bring out their list of questions, they say, oh, I'm so sorry, I've got this whole list of questions. But actually answering those questions, you can do that really quickly and easily if the questions are already planned out and written. So we never sigh whenever that happens. We're there and we want to make sure you can get everything out of that appointment. So whatever is important to you, make sure those questions are written down so you can get them in that consultation, because it's much, much harder afterwards.
Well, the best feeling in the world is when they go, I'm just going to refer to my questions that I'd written down before I came into this consultation.
Love it.
And then they go, you've actually answered them
Yes.
all. I love it when that happens.
So do I. I'll just check what I've written. Oh, they're all answered.
Yeah, all done. Thanks. And we definitely want to know if you're allergic to anything. So just have a list ready of the drug that you're allergic to and to know what happens when you're exposed to that drug.
And also, the dermatologist is really there to help you. So this one treatment that might be perfect for one person might not suit you for cultural reasons or for kind of some belief that you might have, or even no matter how strange it is, the doctor is there to support a treatment that's right just for you. It's to be as personalised as possible. So please make sure you express what's really important about you and your skin problem. And it's probably important to talk about things like major events. You know, have you got a target treatment time that you want to be better for?
Yeah, or even you don't want to start an energy-based device or a laser treatment, for example, or do like some surgery on the face if you've got your wedding in a couple of weeks' time. That's not ideal. So just let us know if there's any major event that's happening in your life that we just need to time our treatments for.
Yeah, I'd like to have a full face skin resurfacing, please. And by the way, it's my daughter's wedding next week.
Yeah.
Okay.
Great, thanks.
Well, that's a wrap for today's episode of the After Hours Skin Clinic. And thank you to the listener who inspired this episode. It's really lovely being able to answer these questions in this kind of format. So please send some more in. We love hearing from you. We want to keep tackling the subjects that mean most to you. So let us know what they are. Details of how to get in touch are all in the show notes. So if you know someone who'd find this episode useful, then please share it with them. And don't forget to give us a follow. Go on, don't even think about it, just do it. Ellie, thank you so much for joining me today.
Have loved it.
And thank you, my lovely listener, for joining us. Bye for now, take care of yourself and your skin. Don't forget your SPF, and see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.